Hello guys, I am here again with the same topic of the diabetes. We have discussed the diabetes, causes of the diabetes, type of the diabetes, pathogenesis involved in it. Today we are here to discuss the management and treatment involved in diabetes. So in diabetes there will be the management of the diet and taking exercise daily which is very important. So before going to that, we will discuss here the important point, that is the patient guideline. So educating patient is very important because a diabetic patient can self-manage himself, because if he is maintaining a lean body weight and doing exercise daily, stopping smoking, and also reducing the glucose level himself by diet control. These are the factors which are playing very important role if you are educating the diabetic patient as well. So coming to the first one, that is diet. Obviously you will plan a diet for the diabetic patient. A diabetic patient, or the food for a diabetic patient, should be low in sugar, high in starchy carbohydrates, high in fiber, low in the fats. So carbohydrates involving the white potatoes have low glycemic index. It should be encouraged, and we should encourage the artificial sweeteners instead of using the sugar. A diabetic patient should avoid of the chocolates, cakes, bakery products, and he should take the fruit juices, not fruit juices, fruits. Fruit juices should be avoided. So these are the carbohydrates involved. Moving to the proteins, in diabetic patient we should limit the fat and oil in the diet, and in the cooking the fried food should be limited, and processed meat should be avoided. So these are the limitations involved. We should encourage the skimmed milk and the low fat yogurt. Vitamins and antioxidants are also taken, but it is preferred that they should be in the form of the fruits, not in the form of supplements. So coming to the second one which is involved in the management is exercise. I have told you already that there is no treatment complete without any exercise involved in diabetes. So if a patient is not able to walk, or there is a problem like diabetic foot, he can exercise on the bed, like he can move his hands and feet if he is able to do that. So this is the tablet treatment for the type 2 diabetes mellitus, which involve the biguanide group, thiozolidine dions, sulfonylureas, DPP4 inhibitors, and the SGL2 inhibitors. So the first one is the biguanide group, the Metformin HCl, which is the tablet for the treatment of the type 2 diabetes, most commonly used, and it is the primary treatment, best validated treatment for the diabetes. How this acts on the cells, and how the metformin acts to decrease the level of the glucose. It actually activates the AMP kinase, which is the enzyme involved in the energy metabolism. Once this activates the AMP kinase, this results in the decrease in the rate of gluconeogenesis. Gluconeogenesis is done through the liver. So once the rate of gluconeogenesis decreases, the output from the liver decreases, and this is how the level of the glucose decreases in the body. So the metformin acts through this mechanism. The second one here is the sulfonylurea group, which act on the beta cell, but it is acting on the normal beta cells. If there is a damage to the beta cell or loss of the beta cell mass, it will not act on these type of the patients. So once it acts on the beta cell, it promotes the insulin secretion. The mechanism of action of the sulfonylurea is to binding to the sulfonylurea receptor present on the cell membrane. Then it closes the ATP sensitive potassium channels. Once the potassium channels are closed, it inhibits the potassium efflux. That is the movement of the potassium ions from inside to outside. So once the efflux of the potassium occurs, it will further results in the process of depolarization. Once the depolarization occurs, the calcium ions from the outside move in, the calcium influx occurs, and which will activate the insulin, and the action of the insulin is enhanced. This is how this sulfonylurea group acts. The third one here is the thiozolidine dions. This thiozolidine dions reduces the insulin resistance. diabetic patients are insulin resistance, type 2 diabetic. So it reduces the insulin resistance by interacting with PPAR gamma, that is peroxisome proliferative activated receptors gamma, are nuclear receptors involved in the lipid metabolism and insulin action. So this nuclear receptor is actually involved in the gene which is regulating this lipid metabolism and insulin action. So this thiozolidine dione group is reducing the insulin resistance. This is how this thiozolidine dione group acts. The fourth one here is the DPP4 inhibitors, which is most effective in early stages of the type 2 diabetes. This group is most effective group. So the DPP4 dipeptidyl peptidase 4 inhibitors are inhibiting the enzymes. So these are inhibiting those enzymes which are increasing the which are decreasing insulin secretion and increasing glucagon secretion, those enzymes. But the action of these inhibitor is to reduce glucagon secretion into the circulation and increases the insulin secretion. So the fourth one is done. Coming to the last one, which is SGL2 inhibitors. These inhibitors are acting actually on the renal tubules. The glucose which is reabsorbed from the renal tubules is through the SGL2 transporter, which are present on the cell membrane of the renal tubules. So these inhibitors are inhibiting the glucose reabsorption. More glucose is excreted through the urine, and this is how the glucose level in the body is lowered. So these all the 5 groups I have discussed here, reducing by some way the level of glucose in the body. So here is the injection therapies for the treatment of diabetes mellitus. So injection therapies for the diabetes mellitus involve the insulin, which may be short acting, intermediate acting and long acting. Short acting insulin involve the Lispro, and this is acting in the emergency conditions like during the labor process, and it is given in the multiple dosage. So the next one is the intermediate acting. The action of the insulin can be enhanced by adding the substances like protamine and zinc. So this intermediate acting insulin involves the NPH, which is most commonly used and widely used insulin, which is isophene insulin. Another one here is the long acting insulin. So this action of the insulin can be enhanced, as I have told you, the by adding different substances. So this is the treatment plan for the diabetic patient. So first we use the lifestyle changes and metformin tablet. If HbA1c is greater than 53 millimole per mole, then we will shift to the patient to the basal insulin and adding the sulfonylureas and DPP4 inhibitors. If there is still the level of HbA1c is greater than 53 millimole per mole, then we will change to the basal insulin and add DPP4s. So, and also adding a short acting sulfonylureas, further changing to the basal insulin and adding the remaining DPP4 inhibitors. If the patient is not stabilizing him and there is a also increased level of the glucose, that is the HbA1c level is still greater than 53 millimole per liter, we will further intensify the doses of the insulin therapy or the insulin injections. So the units of insulins are enhanced, increased according to the glucose level of the patient. So this is the injection therapies involved in the treatment of the type 2 diabetic patient.